Thank you for joining us. Again, we're going to be reviewing coverage requirements for hyperbaric oxygen therapy, otherwise referred to as HBO therapy. This is a topic that was requested by providers during a couple survey comments that we received recently. So mostly we got this from our webinars that we did on wound care documentation. We got a lot of survey comments asking for some follow-up content on this topic. So you asked and we listened. So we're going to be going through an overview of this Medicare benefit this morning. So my name is Rachel Wood, and I am one of the nurse analysts with the Provider Outreach and Education team. I'm joined by my coworkers today. We have the other nurses that work in provider outreach with me, Mary Sue and Jennifer, and we do have some other members from outreach as well as some of our medical review nurses with us as well. So they're going to be helping us monitor the chat and answering questions if able. We are going to answer questions at the end, so if you do think of anything, please send those in to all panelists when you send those to us. If we don't have an answer to your question, we will follow up via email. So I just want to, give you a heads up for that now. And we did get a lot of great pre-submitted questions and comments on things you'd like to have covered today. We will get through almost all of those comments that we got. The only thing that I do want to just preface is that I'm not going to get into a ton of information regarding billing for this service. I will be talking more about the coverage component as well as the documentation aspects and some of the things that our nurses might be looking for, as well as, what Medicare covers in general for this service. So did just want to address that, from up front. And if billing is something that people do continue to have some questions on, you can send that to us following our presentation. We can look into those, or, if you want in our survey comments following, we may consider putting on a separate presentation for that. Regarding materials, this was sent or is available in the WebEx, the WebEx materials are available on our live events page. And so we will, if you do have that or want those slides, I should say, we did put a link to that live events page into our chat. So you can take a look at that and download that if included. All right, so let's just talk about our disclaimer really quick. So basically, this is telling us that this education today is for informational purposes only. Medicare does change their rules from time to time, so please make sure that you look at official CMS communications for the most up-to-date rules and regulations. That does take precedence over anything that we talk about today. We are talking about the updated guidelines as they stand right now, but this is the time of year Medicare does put out some changes, so just be mindful that if anything is sent out after we conclude today's presentation, that does take precedence. Additionally, I am recording this ourselves, and so please do not record or photograph this yourself. We will be putting this out on our YouTube channel as an encore for later reference if you want to go back and re-listen to anything we talk about this morning. All right, so these are just some acronyms that we have on our slide, some things that we will just have abbreviated throughout our presentation. Please take a look back at this if you have any questions on anything as this is your reference. All right, and here's our agenda. So this is also the order that I'm going to go through our information today. We're going to start by talking about the Medicare coverage in general of this service, and then go through some documentation considerations. I'll then talk about some of our pre-submitted questions and some common provider questions in general that we receive on this service. And then finally, we'll open it up for some questions and answers. All right, so I want to start with reviewing what hyperbaric oxygen therapy is. And we did see this in some of the comments of what people wanted to get out of this presentation is, reviewing what what in general this service is and what are we talking about with Medicare coverage for this. So I am abbreviating this to HBO. You can also abbreviate it to HBOT, but just keep that in mind when I talk and say HBO. I'm not referring to the streaming service. I am referring to hyperbaric oxygen therapy. All right, so HBO is a type of treatment for wounds and other indicated medical conditions. During this treatment, beneficiaries will enter a specialized chamber that contain 100% oxygen. And this therapy helps with wound healing by bringing oxygen-rich plasma to tissues that are starved for oxygen. So HBO therapy reduces swelling while at the same time flooding tissues with oxygen. The high pressure in those chambers increases the amount of overall oxygen in the person's blood. The goal of this therapy and the aim is to break the cycle that happens when you have an injury or a wound. So break the cycle of swelling, oxygen starvation, as well as tissue death. And this is something that also helps with to prevent reperfusion injury. And what that is a severe tissue damage that happens when the body blood supply returns to the tissue after it's been deprived again of oxygen. So a lot of, all surrounding replenishing the supply of oxygen to the affected area. So finally, hyperbaric oxygen therapy, or HBO, encourages and stimulates the formation of new collagen as well as new skin cells. We have listed here on our slide a few goals of this therapy. And I did just review some of this information, of what it is, but the goals kind of go along with that. So a couple of the goals when somebody would receive this type of intervention include healing damaged tissue, growing new skin to the affected area, as well as blood vessels, and connective tissue, and then finally promoting healing of infections. So a lot of different things that this can be done for, and first I want to talk a little bit about the different types of therapy and chambers you can go into, I should say. So there are two types of chambers that facilities can utilize. This is more for informational purposes only. Medicare does not have any special coverage criteria for the use of either of these. We would just want to know what type is used in the documentation. But first, there is a monoplace chamber. So what this is a HBO therapy oxygen chamber that is built for one person to use. So they look a little similar to an MRI machine if you've ever seen something, if you've ever seen that. The second type is a multi-place chamber, and this is what it sounds like. It's a chamber that can fit multiple people, so 2 or more. In a multi-place chamber, patients will breathe the oxygen through either oxygen masks or hoods. So those are the 2 different types of chambers that facilities can have and beneficiaries can use if receiving this intervention. All right, so next I want to touch on where this service can be provided. So really, this is anywhere that has some type of those 2 oxygen chambers that we just talked about. So typically if something's seen in an outpatient facility that does specialize in wound treatment. But pretty simply though, where it can be provided, the facility must have one of these specialized chambers in order to provide the HBO therapy to Medicare beneficiaries. So that does include the office as well. Again, the precursor really is to have one of these special chambers at your facility. All right, so let's talk about, what coverage for this service for Medicare beneficiaries is. So coverage can be found in our NCD. That is linked in our resource section, and we will talk a little bit more about just reviewing what that NCD is, the specific number, I should say. But we did include some of the listed covered medical issues that Medicare has in their NCD, which for those that are not familiar, the National Coverage Determination for this service. So most of these that are on our slide here are pretty significant, serious and uncommon issues that can be treated by this service. So for example, acute carbon monoxide intoxication, decompression illness, crushing injuries, necrotizing fasciitis, cyanide poisoning, and the other conditions listed here. These are not something that are your day-to-day health problems, but if by chance the beneficiary is facing any of these listed, can be quite serious, and the intervention of the HBO therapy is something that Medicare will cover and is something indicated for some of the ones that I just went through. I think the most common injury or issue that might occur, and the most common, use of HBO is that treatment for a diabetic wound that has not responded to standard wound therapy for 30 or more days. So I'm going to get into that, into a little bit more specifics into the next couple slides, but the main takeaway with this slide is that we do need to see in the documentation that the HBO therapy is being used for one of those covered indications that is listed in the NCD. And I do just want to preface that you should also reference the NCD because we did summarize the information on our slide just to make sure it all fit, but we could not include every single word for the covered indication. So please take a look at that as a reference because there might be a little bit more expanded info in that resource. All right, so coverage for diabetic wounds. I want to talk a little bit more about this. So the NCD states that to meet coverage criteria for hyperbaric oxygen treatment, the beneficiary must have had a diabetic wound of the lower extremity. The documentation should show that the beneficiary has either a diagnosis of type 1 or type 2 diabetes, and again, a wound that is in that lower extremity is present, and they're currently receiving treatment to the wound that is, again, related to that diabetes diagnosis. The wound must be classified as a Wagner grade 3 or higher, and must have failed to respond to, quote, standard wound therapy for at least 30 days. And we will talk a little bit about what, standard wound therapy might be. So some examples of that. So the next slide does repeat this information that I just went through. We want to just highlight this because this is a common question we get relating to wound therapy and wound treatment, and how HBO therapy can be related or used for diabetic wounds. So HBO treatments only meet Medicare coverage guidelines as adjunctive therapy following, again, standard wound therapy if there are no measurable signs of healing for at least 30 days of treatment. So I, just want to highlight this, and we wanted to give it a separate slide because this is a coverage piece that we are asked about quite often. Again, it's that 30-day documentation, and their person is not responding to standard wound therapy. That does apply to just diabetic wounds. For the other issues that I listed for the coverage criteria, the other things that are included in our NCD, that 30-day period does not apply. It is just for those diabetic wounds as that relates to hyperbaric oxygen therapy. So regarding the standard wound care examples, we do have some of those on our slide here. We do have some good resources as well on our medical review section of our website in the wound care area, as well as, our Encore that goes through wound care documentation. We do talk a little bit more in depth about, what some standard wound care documentation might look like. But some examples include optimization of nutritional status, debridement by any means to remove devitalized tissue, maintenance of a clean, moist bed of granulation tissue with application of appropriate moist dressing, applying necessary treatment to resolve any infection that might be present in the wound, repositioning the person as needed and as frequent as needed. Again, repositioning to offload pressure as necessary. Good glucose control, so that relates to those diabetic wounds. Establishment of adequate circulation to wound beds, and use of compression, again, as needed, as that might apply to certain wounds and, whatever the person might be, receiving the intervention for. So those are just some types of standard wound care examples and some things that we might look for or ask about during our documentation. All right. So next I want to talk about measurable signs of healing, and this relates again to that documentation for diabetic wounds. So we need to see that there are measurable signs of healing, lack of measurable signs of healing for at least 30 days with those standard wound interventions for diabetic wounds to meet coverage criteria for hyperbaric oxygen therapy. This is something that we just wanted to highlight. It's sometimes, either missed or unclear in the documentation. Some examples of, signs that a wound and things to document to show wound healing might be, the wound size. So it's decreasing in size would show that it's healing. So either no change or maybe the wound is actually getting bigger would show it's not healing. Support of healing would be the amount of, pus or kind of drainage, grossness coming out of a wound is reducing. So lack of that would show, again, the wound is not healing, it's not getting better. Necrotic tissue, typically when the wounds heal, the necrotic tissue or that dead tissue in the wound bed will start to, either scab over, go away, kind of fall off, and you'll see some good healthy tissue forming. If that's not the case and you're still seeing, the dead black wound beds, that is a sign that, possibly the wound is not healing. So those are some of the things we would want to see relating to measurable signs of healing or not healing in the case of diabetic wounds for hyperbaric oxygen therapy. So I do want to talk about some non-covered conditions that are in the NCD. And, at this point, we've reviewed a good amount of information. So what the therapy is, where it can be provided, what some of those covered conditions are in the NCD, and then some specifics regarding treatment for diabetic wounds. So on our next two slides here, we did include some common conditions that the NCD specifically does exclude and will not cover for Medicare beneficiaries for hyperbaric oxygen therapy. So I'm not going to read all of these to you since the information is on both the slide and in the NCD. I do want to point out, some ones that might be easy to maybe get confused on. So the first would be, cutaneous and status ulcers, as well as chronic and vascular insufficiency. So those are, fairly common wounds, something that our NCD does specifically exclude for hyperbaric oxygen therapy. So just something to watch out for. And then on our next slide, we have the list of non-covered conditions continued. Again, I'm not going to read this to you, but some of the ones included on this slide, they kind of do have less to do with just wound treatment in general and are more separate medical conditions. So read through this information and just be aware of that. Medicare doesn't cover, every single thing for HBO therapy. So please take a look at that and just be aware of what is not covered for this intervention. All right, so I want to talk about some documentation tips. This was some of the things that were asked about in our, request for pre-submitted information. some documentation tips for hyperbaric oxygen therapy. And so we are going to review, so currently, I should say, we are taking a look in our TPE, or Targeted Probe and Educate review process, for claims that are for those in jurisdictions J5 Part B. And we do have a list of documentation guidance for a successful TPE review on the J5 Part B section of our medical review page on our website. So some of the information that we have included on that, I will go through, but you can reference that article as well. To support medical necessity on the data service that it was provided, some of the information you're going to want to include includes the following. So notes relating to any prior hyperbaric oxygen session, as well as any prior wound treatments that have been tried and failed and relate to the HBO session that you're in question for your claim. Documentation that relates to any prior HBO sessions done. So what we mean by that, so, is this the first session? If not, when was the first session done? How many has this person received? How many overall have been completed, and how often or frequent were they done? What was that response from the beneficiary and the beneficiary's infected area? And, when was the last session completed? Information like that. So that could kind of go on, but that's what we would want to look for as far as any prior HBO sessions. Next would be information that details, again, that response to those prior sessions. So is the diagnosis in question or the wounds being treated improving? If so, how? And if there's not progress of being observed, document that as well. All right, so we have some additional documentation tips here on our slide. We do want to see documentation of the dive records or logs for that date of service that the session took place. So what I mean by dive records, the HBO chamber is a pressurized system, so it is considered a dive when the beneficiary enters into that chamber. We do need documented in the notes for the provider to tell us basically, what's the descent and ascent of the dive in the documentation. So what's that pressure that the person is receiving? We're looking for the depth or, again, overall pressurized levels in the notes, as well as some baseline information for that beneficiary. So some baseline health info could include vital signs before and after, initial assessment of what you're treating prior to entering the chamber, and then the response and what changes were seen following either the session or a little bit after the session. Ideally, we're going to see a reevaluation of the affected wound, an overall reevaluation of that affected area that has been receiving, or for the person that's been receiving the HBO therapy, done about every 30 days to continue to support the effectiveness of this therapy. So those are some documentation elements that we would look for in the notes. Our reviewers are going to look for during their TPE reviews. Before we get to our last, open it up for questions and get to some of our last slides, I do just want to talk about some of the common provider questions we receive. And these are also some of those pre-submitted questions, and comments kind of summed up in some of these questions. So the first one, is it true that Medicare will reimburse for hyperbaric oxygen therapy if it's done in physician offices? So yes, this is, following the documentation guidelines. Medicare will reimburse if provided in a physician office with the necessary chambers and other provisions as well, obviously documentation. So the answer to this question is yes. Next question that we received is some Medicare beneficiaries could benefit from hyperbaric oxygen therapy but their diagnosis is not listed on the covered diagnoses in the NCD. Is there a way beneficiaries can still receive the HBO therapy? So for this question, we do want to point people to the direction of using that advanced beneficiary notice of non-coverage or ABN form. This is what Medicare professionals can provide and should provide to beneficiaries to explain that this is something that Medicare, for this medical condition, Medicare will not cover, and it shows that the beneficiary, is aware of that, understands that, and wants to move forward with it anyway. So if that is the case, if the HBO therapy is something that is still desired, but it's not something that is covered, utilize that ABN form, and then at that point it's up to the kind of patient-provider discretion. And then the final question that we received and have received prior to this event is, does the physician need to be present for the entire hyperbaric oxygen therapy session? So the answer to this question is yes. The physician's presence is necessary for the entire dive time, so the entire time that that person is in the pressurized chamber. That is, not just somewhere around, somewhere maybe available through the phone. They do need to be immediately available in that HBO suite area during, again, the time that the person is in the hyperbaric oxygen chamber. All right. So here are our resources. We have a link to the National Coverage Determination and a change request as well that talks a little bit more about some coverage things to be aware of relating to hyperbaric oxygen therapy. I do also see that in our chat, there's been a couple links put in to that. So, and it does look like we have also put in a link just to our wound care LCD as well. So that is a little different than the hyperbaric oxygen therapy NCD that covers, that talks about coverage guidelines for this specific service. Our wound care LCD does have a lot of good information too, and has great information for those wound care providers. So I do now want to open it up and check and see if we have, any questions that we should answer for the group.
Hi, Rachel. There are a few questions that the LCD answered. I'm just going to say them out loud just so you can hear them. Is 30 days of standard wound care required for all types of wounds, or just diabetic wounds before the HBO is covered? And that is covered in the LCD. I didn't know if you wanted to make any other comments on that, but there was a vast amount of information in the LCD on that, and I know you referred to that.
Yeah, I think we did cover that. I will just say, yeah, the 30 days for diabetic wounds for HBO therapy applies to diabetic wounds. Other types of wounds, what you would need to meet for hyperbaric oxygen therapy, not talking about other wound care, but for hyperbaric oxygen therapy, you would need to be meeting one of those covered conditions, but that 30-day standard treatment would not apply.
The second question is, if the first session of HBO pardon me, is performed less than 30 days after standard wound care, and standard wound care is performed in conjunction with HBO, will HBO be covered after 30 days of treatment?
Yeah, I mean, it all depends again on the documentation and the assuming that the coverage criteria in the NCD is met. And this again applies to that diabetic wound situation. So, but yes, as long as all the other components are met, then that should be something we cover.
Okay, for diabetic, here it is. For diabetic wounds, how often does nutritional status optimization and glucose control need to be documented? at least once every 30 days or less often?
So there's Medicare doesn't provide a specific guideline for specific standard wound care elements to document. So there's no, like, you need to document once every X amount of days that you checked X, Y, and Z. But we do need to see that there is a standardized, some type of wound care, plan of care and interventions that are being provided and monitored for those 30 days. So again, doesn't have to be specifically looking at glucose control every single time, but if that is something you are monitoring, then the more often you can document, the better.
Okay, just going through these. We had a comment that the NCD isn't clear that 30 days of standard therapy is only for diabetic wounds. Does WPS plan on putting out an LCD for HBOT, or if you're aware of any plans to clarify the NCD?
So no, at this time, we do not, to my knowledge, have any plans to put out a separate LCD for this service. I can definitely, and actually the nurses that are on the call with me too, we do sit with our policy department and have monthly meetings. So we can definitely, float this idea to them and see kind of what, and check in and see if maybe there's something on the back burner we don't know about. But at this time, we do not have any LCD for this service that we are working on.
What is the source of the physician having to be present in the area, direct supervision? I thought they changed this in 2020 when CMS changed the supervision requirements for therapeutic services to general supervision.
Mm-hmm. That is a great question. So what is the source? And I would want to just check back for the specific source. I don't know if any of my colleagues have any more information on that, but otherwise I would want to just check myself on my, exact, I want to just find the specific source for you. It should be that NCD, but I do want to just revisit this question. And again, if any of my colleagues have anything they would like to add, please do so.
I believe the requirement for this is that the physician needs to be readily available in the HBO suite, not necessarily in direct supervision and line of sight, but readily available. So not like 3 floors up or the adjacent building, but right there to intervene if the patient needs anything, or if there's issues at all with the dive and they would need to depressurize, sooner rather than later, that physician needs to be readily available. I'll try to find that in the Code of Federal Regulations as well.
Okay, thank you, Mary Sue. And I want to also piggyback on that, because I think the question was the guidelines changed for therapy services, and we wouldn't consider this service a regular therapy service. I think that more would relate to, the PTOT. This would be a little bit different. So, but yeah, hopefully that answers your question, and we will, if not, we can definitely dive deeper in. So any other questions?
I did answer a few separate ones because there were some billing questions, but the last question I had is a billing question. I'm not sure if you want to just refer that for looking up, or you want me to ask it.
We can ask it and then kind of go from there.
Okay, are the reevaluation office visits separately billable, or are they part of the expected care? What if these occur the same day as the HBO therapy?
Okay, so we do want to refer that question and take a look for like the billing specific information to the NCCI edit. As far as reevaluation office visits, So, and when I say reevaluation, I mean, you know, we would want to see like this, what is this wound looking like now? So I think that might get confused with a little bit of like a therapy, like how we talk about in therapies, you know, certification, reevaluation, blah, blah, blah. What we're referring to more or less is that we just want to see a update of how that wound is doing. But again, specifically, and it could occur on the same day as, you know, their therapy session, that would be something that, you know, could happen. For specific billing information, though, again, I am going to refer this question to the NCCI edit. And if you do want us to look, you know, have follow up any specifics, you can definitely email us and we can check into it further.
I did have a clarification on one of the questions we asked. The original question is, are you saying the physician must be present to bill for their supervision? Or does it also apply to hospital charge for the service? And then she just clarified saying, I'm referring to the change of supervision for all therapeutic services, not therapy. And she just would, you know,
Okay.
additional information.
So as far as the charging for the hospital, I don't want to speak on the billing component, but as far as the supervision aspect of that, and it looks like Mary Sue did just put a little blurb into the chat that I'll read. So when we say direct supervision, what we mean by that, again, kind of reiterating what we've just went through, but direct supervision in the office setting means that that physician must be present in the office suite or immediately available to furnish assistance and directions through the performance of the procedure. So it doesn't mean that the physician, you know, needs to be present in the room when the procedure is actually being performed. So that is something, and you know, if we need to look into this further, we definitely can. You know, we can follow up with this person if there's, you know, still some outstanding questions. Right. So I don't see any other questions. Did I miss anything else?
No, I didn't see other questions either.
Okay. All right. And I just want to check in again before we sign off. I think maybe a few if anything else has come through or anything else you want to address before closing today.
We did get one more question, Rachel. If the wound
Okay.
if the wound is not getting smaller in volume, but the provider says the wound is improving, less infection, would that be considered measurable signs of healing?
It says the wound volume. Yes, that would be. So as long as there's documentation that shows, it doesn't necessarily have to be a volume change, because all wounds are going to be different. Some can be very deep but very small. Some can be, you know, both small and not very deep but have a large infection surrounding that wound bed. So any signs of improvement could be a variety of things. And judging by this question, so less reduction of infection, as well as, yeah, so in this example, less infection would be considered a measurable sign of healing. All right. So I don't see any other questions at this point. So I am going to wrap up our webinar today. And I want to thank you all for your participation on behalf of myself, as well as provider outreach and education and our medical review staff. We do look forward to your survey comments and hope to have you sign up for a lot of our future events, because we have a ton listed on our live event page. All right, you may now disconnect.